I'm Seth Gladstein, a practicing medical malpractice attorney in Louisville, Kentucky, and I'd like to talk to you a little about surgical malpractice. All surgeries, no matter how minor or short they are, involve risk. Before you or a loved one undergoes any surgical procedure, your surgeon should review all of the risks, benefits, and possible complications of the proposed surgery. Your surgeon should also review your medical history in order to determine if any underlying conditions may increase your risk for a potentially dangerous complication. A significant number of surgical complications can never be prevented. However, if a surgeon takes no steps to prevent a widely known complication from occurring, and that complication occurs and the patient is harmed as a result, there may be malpractice. My firm, Gladstein Law Firm, is dedicated to helping Kentucky medical malpractice victims understand all their legal options. If you or a loved one has been a victim of a surgeon's errors or mistakes, please call Gladstein Law Firm today at 1-800-991-0474 to schedule your free consultation. It's important you call today because your time to file a Kentucky medical malpractice claim may be limited. Surgical negligence, errors, and mistakes can take many different forms. For example, there have been instances where doctors have operated on patients while under the influence of drugs or alcohol. However, some of the more common forms of surgical malpractice include operating on the wrong body part or limb, operating on the wrong patient, performing an operation that's unrelated to the patient's condition or diagnosis, leaving a foreign object, such as a sponge, towel, or surgical instrument, in a patient's body, failing to timely detect and treat a known surgical complication, such as an intraoperative injury to internal organs, failing to timely diagnose and treat known and accepted postoperative complications. Every patient can take a few small steps to reduce his or her chances of becoming a medical malpractice or surgical malpractice victim. Make sure all your doctors and nurses know about all the medications you take, their dosages, and whether you are allergic to any drugs or latex. Make sure all your doctors know about any health conditions that you have. Perform some basic internet research on your surgeon to determine whether he or she has a history of surgical malpractice. Have a loved one accompany you to your doctor's visits. That way, somebody else knows about your health condition and the procedure that's going to be performed. Research your condition as well as the procedure to be performed. Of utmost importance, pay close attention when the doctor reviews the possible risks, benefits, and complications of any proposed surgery. And after surgery, be sure that you become familiar with the common signs and symptoms of potential complications. Never ignore nagging or persistent pain or other symptoms after a surgery. Be sure that you follow up on all test results. Never assume that no news is good news. And always call your doctor if you have any concern or any questions about your condition. If you or a loved one has been a surgical malpractice victim, please call Gladstein Law Firm today at 800-991-0474 to schedule your free consultation. You can also reach us online at www.gladsteinlawfirm.com. Please don't hesitate to contact us because your time to file a Kentucky medical malpractice action may be limited.